In Geneva, we invited Tarik Jasarevic, who is the spokesperson of the World Health Organization. Sir, thank you for taking your time and joining us on this very critical moment. Tell me more about your latest assessment in terms of the outbreak, both in China and globally.
Well, we are receiving information from national health authorities from China, but also from other countries around the world about possible new cases. We know that a huge majority of cases right now have been reported from China. 99% of cases have been reported by China, but we see that other countries have reported cases as well. We know that this coronavirus is being transmitted through droplets to close contact. So we have seen some onward transmission. But again, as Director General has said, as we don't see a huge rapid spread of the disease at this moment, it is a window opportunity to work all together. So to try to put in place necessary measures to contain the possible onward spread.
Mr. Jasarevic, I'm sure you are aware of the latest assessment also given by Dr. Zhong Nanshan, who's a very well-respected scholar from China. He's been talking about, he expects, that I quote here, there's likely to be a wrap-up of the outbreak by April. He said he hoped that would be the case. And there's likely also to be a peak of the outbreak in the middle and the end of this month. Your assessment, do you concur with that, or it's hard to say?
Well, for us, we really think it's hard to predict how this outbreak can go. We have seen in the past with other diseases that epidemiological curve can go up and down. What is really important is to work all together to put in place measures so we do our best, so we don't see a rapid spread of a disease among populations in different countries. So part of that is what we are doing exactly right now in Geneva these 2 days, getting best scientists around the world, getting together, trying to look into what needs to be done in coming weeks and months to, from one side, try to understand a virus better, and on the other side, try to already work on solutions. So
right.
Again, we have time to work together, and this can be contained if everything is being put in place collectively by governments, by scientific community, and WHO is there to help everyone.
Can I clarify here, Mr. Jasarevic, on behalf of the WHO, you are not going to put your finger on a specific time or a specific date, either about so-called peak or about the so-called turning point or the wrap-up of the disease. Is that correct?
That is absolutely correct. So we think that it's difficult to predict where the outbreak can go. And we have seen in the past that predictions may not turn out to be true. So really, we want to focus on working together and on solutions.
Let's talk about the solutions, since you've been focusing very much on that topic. And right now, there's forum going on about the global effort to tackle with the outbreak. Quote, if I could use, identify the source of the virus and also share biological samples and genetic sequences. That is the goal, as WHO earlier indicated for this forum. Now, so far, any outcome, any achievements, specific results particularly, Mr. Jasarevic, anything to brief us?
Well, we will have a press conference tonight after the end of the meeting where we will hear from WHO and from the co-chair who are running this meeting. I think what is really important is to stress that there is a really large number of questions that are being discussed, and what we expect is to have a clear roadmap on what needs to be done. And it's not only about genetic sequencing or sharing the material, it's really about trying to see what studies need to be done. So we understand really the transmissibility of the virus. We understand its severity. Then also another part is to work on treatments and work on vaccines. What kind of trials should be put in place? Also to look into what is the source of the virus. So basically we look into a really variety of questions from technical and scientific point of view, and what we want to have is to say, okay, these are the areas we need to focus on as a global scientific community, and this is the roadmap, because we know that many researchers is already being done. We want really to convene everyone, so this research that is being done about this COVID-19 virus is being coordinated, so we can really collectively profit from the scientific work that is being done.
If you look at the coronavirus over the past 20 years or so, there was SARS, there was MERS, and now there is the COVID-19, as you said. Isn't it a bit slow, if I could use a word to describe the process now? We are still not sure as to what is the intermediate host of the virus, even though we might be sure at this point of the host of the virus, which is likely to be the bat. So is that a little bit too slow? After all, we've been having crisis as a result of the coronavirus over the past 20 years. You might argue they're different, but still, people wonder, haven't we learned much?
Well, coronaviruses, we know, circulate in animal world, and there are a number of these viruses that have been identified, but a majority of them have not really got to the human population. And I'll just remind you, for example, that we know for MERS that is being residing in camel population. So we have to understand where in animal world the virus is, and that's important because in that way we can reduce the possible exposure, and that's again part of the work that will be done in the future by scientific community to try to understand. What is really important is that beside this scientific work on understanding the source is to work with the health systems so they are ready to deal with any outbreaks, new cases, how to detect them, how to test them, how to treat infected people. We know, for example, from MERS that MERS can be transmitted in a hospital settings. So we have to make sure that health workers are protected, they are equipped to reduce the possibility of them getting infected with the virus. So the work we want to do is to accelerate the research. We have relearned, for example, from Ebola in 2014, that if we get our efforts together, we can accelerate the work on treatments and on vaccines. For example, we are now using vaccines and treatments in Ebola outbreak in DR Congo that have been developed in a very short period of time. So we want to use the same approach here, so to accelerate what normally takes a long time to produce a vaccine, to get the compounds, to the clinical trials, to do mass production. And the idea is really to get and make things faster than what usually would be.
As far as I know, sir, that will be at least 18 months, right? According to the latest information coming out of the WHO vaccines.
Well, we will have to see really how, because it depends also how fast we can develop the compound that it's used in the vaccines, how well the clinical trials are going, because for any treatment, there are strict rules on the clinical trials. First in a small number of people, then in a bigger number, and then there's also issue of mass production.
Absolutely. So you're saying it could be longer than 18 months, but not necessarily shorter. Is that what your general assessment of the vaccine so far? Because there are a lot of mixed information. People are confused as to what exactly is the timeline or could be the timeline.
Again, I can't really give you the timeline right now. We have to really look into all different parameters, and then to add different time periods that are needed for different phases, and then before giving any timeline. Again, that's a part of the solution. That's vaccines and treatments. What really we have to all understand, that the bigger part of solution is how we all behave and how we equip our health systems. If we all adopt responsible behavior, and if we equip our health systems around the world with the necessary technology, with necessary equipment and supplies, if we train health workforce, we will be able to reduce the number of cases by reducing the risk of exposure and transmission.
But you know, we've been hearing those over and over again when there were global public health emergencies. How come we're saying the same thing once again? We're hearing the same thing once again during an outbreak as latest as today, Mr. Jasarevic.
Well, every outbreak is different, every disease is different. So, and the challenges are different, the context is different, and the solutions may be different. So it's really difficult to say that that if we have outbreaks of different diseases, that we can always apply the same the same solutions. But one thing we know, and this is something that is part of international health regulations, we want countries to invest in health systems. So whatever pathogen is, whatever disease is, countries have strong health systems that can allow them to quickly detect and respond to outbreak, whatever pathogen is. Unfortunately, we know that many countries in the world do not have that core capacities. And this is why Director General was saying that one of the biggest fears is, what if this COVID-19 virus comes to countries with a very weak health system? Will they be able to respond adequately?
What about the WHO delegation of experts? They are already in China. We understand their mission is to interact with the Chinese side for communication and exchanges of information and analysis. What are the latest they are having right now on the ground? Your take?
Well, advanced team has arrived in China. We are waiting for other members to join them. And as you said, they will work with the Chinese health authorities, with the Chinese scientists, trying to understand the situation, trying to learn from Chinese experts on the response that have been put in place. So this is something that we obviously will be reporting on as they start working with the Chinese counterparts.
How big a team will it be? Of course, you're saying the advanced team has already arrived, but later will be joined by other members. So how big a team eventually it will be? How many countries will experts be coming from? What are likely to be the areas these experts are from? What are exactly their job descriptions on the ground besides exchanging, sir?
Well, this is exactly what is being discussed. As Dr. Tedros has said, we are expecting a team of about 10 people representing different expertise that are normally being called upon in outbreaks of infectious diseases. And again, their terms of reference, if you wish, will be really worked on together with the Chinese counterparts once they start to work together.
Another thing, of course, is the front line. We understand in particular the epicenter of the outbreak of Wuhan, very being stretched, the resources and also medical workers, extreme stress and pressure. What are some of the important principles, sir, the WHO would hold closely in terms of how to handle a situation like this, and protection and respect for the medical workers as well?
Well, we have repeated on several occasions that we really appreciate the work that has been done by health workers in Wuhan. Not only health workers, but the whole population of Wuhan is in a very difficult situation, and they bear the burden of this outbreak the most. By working hard, as health workers are doing right now in affected areas, they are protecting not only people of Wuhan, but they're also protecting the world safe, because they are trying so hard to reduce the risk of onward spread. We know that for most of diseases, health workers are most at risk, because they are in contact with people who are sick and they expose themselves. So we should always think about how heroic their work is, because they are putting their life in danger to protect patients, but to protect all of us.
What do you think are some of the most important supplies and resources health workers on the front line should have under such circumstances?
Well, we have issued a set of guidance at the very beginning of this outbreak on clinical management of the patients, on a reduction of infection and infection risks, so infection prevention and control measures within the health facilities, because it's really important that health facilities remain places where the virus will not spread to other patients and to the health workers. So within those guidances, there are detailed instructions what protective equipment should be used when dealing with the people who are confirmed, and we hope really that we will be able to help, especially countries who do not have enough of capacities with the diagnostic tests, with the supplies and equipment. And we are preparing specific kits, so boxes that will be sent to the countries that we know may need it. So in case they get cases, that they can equip their health workers so they stay safe.
Would these countries that you just indicated include China, include Wuhan, for example, the epicenter of the outbreak?
No, well, we are mapping really, and this is what Dr. Tedros is saying. For example, we identified 13 countries in Africa that would really be important for us to work with them, with those countries, and trying to see what exactly they need and how we as WHO can help. China has a developed health system in the past years, so we really, as WHO, we can help China in this work on scientific galvanizing of the community and sharing the information. But really, there are countries in the world that we need to help with the more basic things, such as supplies, diagnostic tests, and other things.
The Director General of the WHO earlier indicated at a press conference that he is willing to come back to China, to even the epicenter of the outbreak, to Wuhan, to visit people there. Is there any timetable?
Well, he indicated that he is willing. I will just remind you that during the current Ebola outbreak in the Democratic Republic of Congo, he went on a number of occasions to the epicenter, and obviously if this could be done, and if it is being agreed, then he will do that.
Yeah, and finally, before we go, I want to understand the structure with which WHO is working right now. You have your headquarters, which you are representing now as the spokesperson. Meanwhile, you also have regional headquarters here in Asia. Meanwhile, you have a very strong country office who have been working very hard on the issue. How are you working on a daily basis about this outbreak, and what is likely to be the specific roles of WHO at different layers in your interaction with the Chinese side?
Well, as you have already said, WHO has 3 levels in its organization. We have a headquarters here in Geneva. We have a regional offices. We have 6 regional offices, and then we have country offices in about 150 countries. When there is a major health situation happening anywhere in the world, we set up the system by which we work closely. We have calls, 3-level calls, as we call them, with our regional and and our country offices trying to coordinate the activities. Obviously, country offices are our people who know the country, any country, the best, who already have relationships developed with the national health authorities, and their role is a vital, really, in especially at the beginning, and trying really to start the work going. But as the situation may progress to a global level, then obviously from the headquarters side, we are mandated to organize meetings such as we do now, where we will convene people from all over the world to work together because it's once it becomes a global problem, and WHO has declared public health emergency of national concern for COVID-19 virus, then we want solutions also to be taken on a global level.
Tarik Jasarevic, the spokesperson of the World Health Organization based in Geneva. Thank you so much, sir, for taking your time and joining us at this critical moment. Really appreciate it. All the best.
Thank you. Thank you very much. Thank you.
That is our exclusive interview with the WHO spokesperson. Thanks for watching. I'm Tian Wei. Bye for now.